Besides primary care, which is of course a big focus, I think it's giving me an idea of how to view medicine, not only from the point of view as a practitioner, but also from a patient perspective and also from a overall big picture, like how things run.
For me, I wanted to be in a program that I could get all the medical knowledge, the clinical skills, as well as prepare me mentally for being a doctor. Also, I wanted to have a supportive environment, and I get that in CIFC.
What really sets us apart is that we are a true primary care program. And our curriculum is structured in such a way that residents get blocks of time in the outpatient setting. They get to rotate with the same primary care physician for a long period of time. And what that does is they get to see primary care in action, in real time, in real life, where they see the relationship the primary care physician has with the patient, and they also get to experience the healing effect that brings in to patient care.
That is an extraordinary leap from what the traditional residency training program was. And the advantage is that you're embedded into the community, you're caring for patients that you see here, but also see in the hospital and that live in your area.
I think for somebody that wants to go into primary care, it's really unique in that it's one of the only internal medicine residency programs in the country where you're going to get that education that's focused on outpatient medicine. We're really committed to getting you a wide breadth of outpatient clinical experience that you just won't get in any other internal medicine programs.
Primary care really is the basis of healthcare. When a patient is sick, the first place they go to is primary care. And when you have a robust primary care system, what happens is patient gets the right care or the right referral or the right intervention at the get-go. Hence, training residents in primary care becomes really important for the overall healthcare of the community. A federally qualified health center really embodies what underserved medicine really looks like and what it means to give back to the community where the need is the most. And our residents get the training to practice culturally sensitive and cost-effective medicine. And that is really important because you don't get that training if you were to go out there in a regular primary care practice in the community. It's a 3-year residency program. Our goal is to train our residents in primary care, but our goal really is to make them balanced physicians. So we prioritize outpatient medicine, but we also prioritize inpatient medicine, and we make sure our residents have sufficient amount of inpatient training. Outside of regular training in the clinic, our residents have opportunities to go and do outreach in the community with our outreach team. They can go on the mobile van and provide services in the community. And we have a global health program where our residents go to places outside of the USA. This residency program really expands more than just the local and regional community. It really strives to be a teaching program for the global community.
As a medical student, if you know that you really want to go into primary care, then this is the place to be. You're able to learn so much from just a primary care perspective. Being in this area of Connecticut, you're able to explore and learn so much about other people's cultures and languages, which kind of helps you be a better doctor, be a better primary care provider in the long run.
CIFC, it's been really great so far. My intern year was amazing, and during my second year so far, I've learned a great deal. And the supporting staff, as well as our program director, associate program directors, just to be very hands-on, doing multiple unique things like ultrasound, doing joint injections, and many procedural things within clinic, which is not something that's commonly done.
Well, I think one of the big advantages that we have here is the variety of clinical experiences in the outpatient setting that you'll get to have.
Not only do we have internal medicine here, we have pediatrics, we have dental, we have behavioral health, we have WIC program, we have SNAP program, we have low-income housing. And what it does when we have all these different departments is care becomes comprehensive and centralized, and that opens up opportunities for collaboration with the sole focus on making the patient's life and health better.
It's a really team-based approach to providing care, where the patient gets to see and know you as a primary care provider who offers them that continuous, integrated care, whether they're here or in the hospital, and really makes a difference in improving their health, not just taking care of their sickness.
We focus on patient care, but we also focus on making sure our residents get the latest in terms of technology, in terms of teaching. We have developed a robust program in point-of-care ultrasound, or POCUS. We have curriculum and a certification process in point-of-care ultrasound in the outpatient setting. And we are really excited about that because that gives our residents and graduates that extra tool to be able to go out and practice medicine with the cutting-edge technology that we have right now. Each resident is different. They come from different backgrounds, they have different personalities, and they have different ways of learning. And what we try to do is recognize every resident as who they are and provide them the support they need. And the first step in really doing that is getting to know them.
Because we value the residents so highly and because it's such an important part of our mission, everything is kind of one big family, and everyone is very welcoming and appreciative of the residents here.
I'm actually going to Vietnam, and that's for a part of Global Health Program. When I first raised my interest in it, they were immediately so excited for me, and they're yes, let's make this happen. And I'm so excited. I feel like they're always trying to support my interest and pursue it.
They train you really well here. I'm now in my third year, and as time went by, I became more and more confident. They're very approachable. They work with you one-on-one. They're amazing.
I'm an introvert, and one of the things that I had struggled with going into residency was being able to communicate with my faculty and they being able to bring out my strengths. CIFC is a program where you get to be yourself. With the faculty, they care so much about you. It's not just about the medical experience. It's a collaborative environment, and I just love that.
Family is a word that I would use to describe CIFC. We're very close-knit amongst ourselves within the residents and the attendings. Most of the residents feel very comfortable with every attending. We all have an open door policy. They can come in and talk with us about anything at any time. Everybody has my phone number, and they can call me at any time that they need anything.
They want your own personal growth to be at a level that when you are an attending, that you're able to manage and do things on your own.
The goal we have for our graduates is be excellent primary care physicians and serve the community. We want to create leaders who go out there and change the way we do medicine for better, change the way we look at healthcare and make it better, not only at the local level, in the regional level, and at the national level, because primary care at this time has potential to provide so much more for the community and the patients than it is right now. And we really try and strive hard to prepare our residents for that.